healthcare field, the decision makers, the most important decision makers, are really the healthcare professionals who provide the care for the patient. And so when we look at the value of health library and information services, what we have to look at is whether the health professional was able to make better decisions regarding patient care as a result of the evidence-based information that they received through either using the library services themselves or going to the library or getting assistance from one of the library staff. So we checked this out in advance with administrators, and basically that's what they told us. That's what they wanted from us. And that's what you have to do if you're going to do a study that's going to be effective at advocating. You have to address the issues that people tell you are really important for decision-making within that institution. Okay, this particular study called The Value of Health of Library and Information Services in Patient Care was undertaken actually only after a 5-year planning period, because we wanted to do a large-scale study which included multiple institutions. So it was a multi-site study. And to get cooperation of all those sites and get ethical approval and everything, and to actually then collaboratively, using what we call community-based collaborative research techniques, to actually collaboratively develop we were going to use an online survey. The online survey and the whole protocol for administering the survey and so forth, that all took a long time. And we had a wonderful planning group that consisted of researchers and administrators and librarians from the National Network of Libraries of Medicine in the U.S., the Middle Atlantic region. And we were able to actually extend the study to participating institutions throughout the U.S. and Canada. So in the end, we had 59 sites that were able to participate. And the outcomes were, just much more than we ever anticipated in terms of the number of people, the number of health professionals, physicians, residents, and nurses who responded. We got over 16,000. And so it's probably the largest study of its kind that has been done. And it honed right in on the changes that they had made to patient care as a result of, using the library databases. We asked them to pick a patient care situation in which they needed more information. So where they felt, they got a little stuck, that there was something else that they needed to know in order to give the best care to the patient. And then to do the search or ask for assistance in doing the search, and then to tell us what happened at the end. And so we asked them if they changed anything, whether the information made a difference to things like diagnosis, choice of test, choice of any medical device, or choice of medication, all of those sorts of things. We even asked whether it had avoided patient mortality. And so we had this measure of the changes that had been made to patient care. So we were really honing in. There were a lot of things that we could have asked about how satisfied people were with services, or how often they used them, and all these sorts of things. But we didn't. We really wanted to look for changes, differences that the services made, because we really felt that that would be the most effective for making a case for the library. And there are quite a number of hospital libraries that are really being threatened these days with cuts. Healthcare is constantly in a state of change, and administrators are always looking for ways to save a little money. And we needed to have evidence as to what difference the library made. We took a risk in doing it. We didn't know what the outcome would be of the study. Fortunately, it was a very, very positive outcome. We also found that we saved the health professionals a lot of time, and time is worth money. So, but they really valued the service, and they valued it in a way that really affected patient care. And it changed, in many cases, the most common outcome was it changed the advice they gave to the patient and the family. So I felt that was wonderful, because nothing could be more important now than that communication between the health professional and the patient and family. We're all part of the team these days.